Assalamualaikum warahmatullahi wabarakatuh. So for today presentation for Ahbs 3274, me and my group members, which is Nur Ashikin binti Muhammad Zawawi, Syamina Amir binti Syahruddin, me myself, and this is another one, Zuliza Syafiqah binti Zulkafi. So for today we'll be presenting about the descriptive epidemiology of lung cancer.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Ashikin binti Muhammad Zawawi, and for the introduction of lung cancer, this is the content of our slide. Lung cancer begins in the lungs and may spread to lymph nodes or other organs in the body, such as the brain. Lung cancer are grouped by two types, which are small cells and non-small cells. These types grow and spread differently. In small cell lung cancer, only about 1 in 10 to 3 in 20 people with lung cancer have small lung cancer. It is almost found in smokers. For non-small cell, there are three major types, including adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Okay. This is aim and objective of the study. The aim is to provide a descriptive epidemiology of lung cancer in Malaysia. The objective is to study the incidence and mortality rates of lung cancer patients in Malaysia. Next, we move to the background of lung cancer. Lung cancer has been consistently the leading cause of cancer incidence and mortality worldwide over several decades. In 2018, according to data from GlobalCan 2018, there were over 2 million new lung cancer cases and 1.7 million deaths, representing 14% of the total number of new cancer cases estimated globally and 20% of the cancer deaths. Meanwhile, according to the 2014 World Health Organization report, lung cancer accounted for 19.1 deaths per 100,000 population in Malaysia, or 4,088 deaths per year, 3.22% of all deaths. The most important cause of this lung cancer is tobacco smoking, with tobacco classified as carcinogenic in humans. Tobacco is in group 1A. Lung cancer was the third most common cancer in the Malaysia, but the second most common cancer in males and the fourth most common in females. I'll pass to the next presenter for descriptive analysis.
Assalamualaikum warahmatullahi wabarakatuh. Now I will continue the presentation to discuss about the incidence of lung cancer in Malaysia. So based on the multi-bars provided by GlobalCan 2020, the highest prevalence of lung cancer is in Indonesia, whereas the estimated number of incident cases of lung cancer in both males and females in Malaysia is 5,129 according to GlobalCan 2020. Malaysian National Cancer Registry Report 2012-2016 declared that there was a total of 11,256 registered cases of trachea, bronchus, and lung cancers compared to 10,608 cases in 2007-2011 report. There is also 68.3% of the cases are among males, whereas 31.7% were among females. Next. From the data provided by the Malaysian National Cancer Report, the latest 2012-2016 incidence in males and females was slightly decreased compared to 2007-2011. The age standardized incidence rate for lung cancer in males is 13.2 per 100,000, whereas for females, the age standardized incidence rate is 5.9 per 100,000. The highest age standardized rate of lung cancer incidence of both sexes was from the Chinese ethnicity, then followed by the Malay ethnicity, and the least lung cancer incidence rate was from Indian ethnicity. Next. According to GlobalCan 2020, the estimated number of prevalent cases of lung cancer in Malaysia is 5,909, ranked 6th in Southeastern countries. The lifetime race is approximately 1 in 55 for Malaysian males, while the highest race is contributed by Chinese male, 1 in 43, followed by Malays, 1 in 62, and Indians, 1 in 103. For women, the risk of lung cancer is lower, where it is approximately 1 in 135. Next. As we mentioned before, there was a higher risk of lung cancer cases were among males rather than females. Among the three major ethnicities group in Malaysia, the Chinese people are more vulnerable towards the lung cancer from this data. It is clear that Chinese males has the highest risk of getting lung cancer, according to the Malaysian National Cancer Registry report from 2012 to 2016. Next. So based on the data by Global Can 2020 also, it is recorded that estimated number of 4,509 number of deaths from lung cancer cases and rank as the highest mortality rate of cancers in Malaysia. Lung cancer accounted for 24.6% of all cancer deaths among males in the country, while the cancer mortality for females accounted for 13% of all deaths in 2014. Next, I pass to the next presenter.
Thank you, Sister Zuliza. So I am Shamina Amira binti Shahrudin, and I will be continue on the statistic of stage of lung cancer at diagnosis in male and female patients. So this is from Malaysian National Cancer Registry report from 2007 to 2011. So from the pie chart, we could see that the majority of the percentages showed that most of the people that are diagnosed with lung cancer are already suffered at the stage 4, which they need to reach for cancer treatment very soon to survive. This is mainly because the people of Malaysian are still in the low level of awareness regarding this lung cancer. So next, I will be explaining more on the risk factor of this lung cancer. So basically, what are the risk factors? So there are the research that found several risk factors that may increase the chances of getting the lung cancer. So the most lung cancer is actually caused by the smoking, which is we can say that almost for Malaysia, it is about 90%. This includes both active and also the second-hand smoking. So tobacco smoke contains more than 400 chemical substances. Most of them have been identified to cause the lung cancer. And then smoking 20 cigarettes per day in times compared to non-smokers. Then when a smoker quits smoking, the risk of lung cancer is reduced. And after quitting for 15 years, the risk of getting lung cancer is the same as non-smoker. And the cigarette and also the pipe smoking also increases the risk to develop the lung cancer. So move on to the next point, which is other causes of lung cancer, which is air pollution from vehicles, factories, and also others. Other than that, this patient of lung cancer can also get the lung cancer from the exposure to asbestos, as it increases the risk of lung cancer to several times higher. The interaction between tobacco smoke and also asbestos increases the risk to 50 times, and as the mesothelioma, which is the cancer arising from the lung pleura, is closely related to the exposure to asbestos. And then other than that, we can see that lung diseases also contribute to the risk of having the lung cancer, such as having tuberculosis or chronic obstructive pulmonary diseases, and also increase the risk. And then people who expose more on the radon or radium, which is a compound derived from uranium, also increases the risk. And then last but not least, the occupational exposure to arsenic, chromium, nickel, aromatic hydrocarbon, and ether also can increases the risk. This is from Doty 2012. Next, we'll be talking about the cause of this lung cancer, which is this cause actually estimates include the cancer attributable cause for medical services and also oral prescription drugs. So lung cancer is recorded in top 5 types of cancer that requires the largest national medical services cost and highest in national oral prescription drug cost. The differences in national costs reflect the prevalence of disease, the treatment patterns, and also the cost for different types of care for the different cancer sites. So in Malaysia, the cost highly because the public become the burden to national, because the public healthcare in Malaysia is heavily subsidized and also offers services at a fraction of the cost of treatment in the private sector. and also the total expenditure on health was 4.24% of the gross domestic product in 2017. This was reported by Raja Durai et al. 2020. So next, this is the cause of the lung cancer. We could see that the number of from the National Cancer Institute, which is 2022 from Cancer Trends Progress Report, we could see that among all the types of cancer, lung cancer also requires high estimates of national expenditure for this type of cancer. Okay, next. Okay, so this is because we could see that the trend for the estimated lung cancer new cases are increased. We could see the increment from 2020 to for the next for the next few years, which is 2035, which it is showed that increment new cases 1.05 million. Next, this is the estimated number of deaths, which is the prediction. Also showed that the trend of the national burden also increases for this lung cancer. Next. Okay, so we talk about the control methods of lung cancer in Malaysia. While Malaysia is an upper middle income country with a strong healthcare system and good socio-economic programs, cancer survival rates in Malaysia are still below the rate or average rate of developed countries. This is due to variety of barriers faced by the people with cancer, including the low cancer awareness and also the low screening rates, delays in seeking medical care, delays in detection and diagnosis, and inadequate access to quality care. So the first control method by Malaysia, which is in an effort to improve the awareness, a national level non-governmental organization, which is Lung Cancer Network Malaysia, was established in 2018. These organizations are to aim to increase the awareness, promote appropriate screening, and also to counter the misconception so that more patients will be diagnosed at earlier stages. Amendable to curative treatment by Raja Durai et al. 2020. And other than that, we have the M-Quit program was introduced as an integrated quit smoking service offered in both public and also private facilities in Malaysia. The program has recorded just above 30% success rate in helping the smokers to quit, whereas most of the remaining participants will merely reduce the amount of cigarette smoke. And then the third method was the measure also do some campaign on banning the sale of cigarettes to minor, outlawing the tobacco advertisement, displaying graphic warning on cigarette packages, and also prohibiting smoking in public areas and eateries are the anti-smoking strategies in force in Malaysia. So the next is the government is also working to increase the access to drugs by making them more affordable to the patient. And next, the oncologists also have started to travel to hospitals in states that don't have the oncology services to lend their expertise and reduce the waiting times for people with cancer in those areas. So finally, last but not least, the Clinical Research Malaysia was established in 2012 by the government to help the clinicians in the country conduct impactful research and collaborate with top scientists around the world to bring the innovative treatment to people with cancer in Malaysia. So that's all for the control method.
As a conclusion, there are still significant gaps in knowledge about cancer-related signs and symptoms and risk factors in Malaysia. Therefore, there is a need to increase cancer symptoms awareness across Malaysia in adults aged 40 years and older who are higher risk for cancer. Also, increase awareness about cancer risk factors, in particular dietary and lifestyle-related risk factors. Funding limitation for treatment pose a significant challenge in lung cancer management in Malaysia. Increasing local awareness about lung cancer is important to help high-risk patients get screened and reduce the percentage of late-stage disease presentation. Efforts to tackle the high smoking prevalence, a major risk of lung cancer, are also underway. That's all from us.
Thank you.
Yang slide difference.
Dah boleh tutup hari tadi. Kita ulang.